Welcome back to Colorado and Company. Senior Source here at 9 News is a big part of our community outreach. And today we hope to help you with any questions concerning a loved one that may be facing mental health concerns. Liz Smith is here from the Jefferson Center for Mental Health. She's offering some sound advice. Nice to see you.
Nice to see you.
How big is the elderly population, the concern of mental health here in Colorado?
Well, you know, depression and anxiety are not a normal part of aging, but unfortunately there are too many seniors out there who are suffering, and in fact, up to 1 in 4 older adults may experience some signs of depression and anxiety. So you may have many of your viewers who know family members or friends who are older adults who are experiencing sadness and irritability, excessive worry that really does negatively impact their quality of life.
So sad. And so you mentioned depression and anxiety. Are those the two major concerns?
They are the two major concerns, and unfortunately those depression and anxiety can get masked by other medical conditions. So if you're unsure, it's really important to ask a professional. For example, some seniors have chronic heart disease or diabetes, and depression often accompanies those two conditions.
Right.
But too often it goes undetected, so it's really important to contact your primary care physician.
What I don't understand is, why does this surface later in life? Like, if you have anxiety, wouldn't you have it all your life?
Well, you know, there are many benefits that we all experience as we age. Certainly spending more time with friends and family members and loved ones, doing things that we really enjoy doing. But there are some challenges that come up at this stage of life that are different. For example, health problems that may come up, or chronic disease, the loss of family members and friends, financial stress. So the feelings of loneliness that can come when family and friends don't live locally anymore. So there are a number of reasons why coping at this stage of life can be difficult.
And you have to have somebody to talk to and reach out to. You can call 303-425-0300 for more information, or go to jcmh.org. That's their website. Now, what are the signs for someone when they know that they need to reach out and get help?
There are some very important signs that your viewers need to be aware of. First, any signs of confusion that an older adult may show, or signs of, as we mentioned, sadness, or a senior who is socially withdrawing, not experiencing joy in activities that they once did. Changes in physical appearance, knowing a senior who typically is very well put together, but suddenly is looking disheveled, or their clothes are dirty. Home repairs that are piling up, trash that is piling up, or pets that are being neglected.
A lot of signs. And once we see some of those signs surfacing, what should we do?
You know, it's really important, I think, first and foremost, to talk with that senior and to ask them how they're doing. And if you have a concern or worry, to talk with them about it. Certainly contacting your local community mental health center is a good thing to do. Encouraging the older adult to contact their primary care physician is also good. And for anyone who is experiencing an urgent mental health need, the Colorado Crisis Services line is available. And this is a 24-hour-a-day, 7-day-a-week crisis line that is available for anyone who has an urgent mental health need. And I know you have that phone number.
Right, yep, we'll give it out, and there's a number at the bottom of the screen for you too. How are they responding? I mean, as a senior, though, they lived all their life without reaching out and getting help, and maybe some may be embarrassed about a mental illness. They don't want anyone to know.
Right.
So what are the responses from the elderly, the seniors that are suffering from issues?
You know, older adults have a lifetime of experience of solving problems, coping with challenges that they've had, and there's a natural resiliency and strength that comes with aging. And in fact, seniors actually respond to mental health services just as well as the general population.
Good. And it's a good point for people not to be ashamed.
No.
We need to spread the word about mental illness to help others.
Exactly.
Yeah.
You know, I think we've come a long way in terms of people knowing that good mental health is important for our overall health. If you or I had a problem with our tooth, we wouldn't think twice about going to the dentist, and we wouldn't worry about friends or family members who may think less of us. And for seniors who, I think, have grown up in a pull yourself up by your bootstraps kind of culture, you know, you didn't admit to having problems, you didn't ask for help. So I think those are some of the barriers that seniors experience in terms of receiving mental health services.
And what do we do? How can we help a senior if it's our mom or dad and they're struggling? What should we do at home alongside them to make sure everything's okay?
You know, I think first and foremost, really listening and talking with your loved one. And if they are telling you that they're struggling, really believe them. There are too many misconceptions that depression and anxiety are a normal part of aging, and I think sometimes people minimize or dismiss some of the struggles that seniors go through. But showing that kind of care and concern, and if they're not talking about a problem they have and you suspect it, to really share with them what your worry is. And again, contacting your local mental health center, contacting the Colorado Crisis Service line for urgent mental health needs. These are all good things to do. And you know, for those of us who are not seniors yet, we will be at some point in our life if we're lucky. So this really is about how we can create communities that watch out for one another and care for one another.
A positive message, yeah. We got to reach out and get the right help to make sure that we're all healthy and happy. Thank you so much for coming on the show.
Thank you.
Really appreciate it. If you or a loved one needs more insight, please call Jefferson Center for Mental Health's phone number. Here it is. It's 303-425-0300. That's 303-425-0300. Seniors may be afraid to ask for help or may not know where to turn. Another phone number to have on hand is 844-493-8255. That toll-free number that you can reach out for if you have any problems. It's 844-493-8255 for mental health crisis services. And this is for all ages, of course. Well, when the big